in the fact that the combination of the therapies is what makes what we do so powerful, okay? We can do just cranial facial release, which is powerful all by itself. We can do Sananga all by itself, you know, but when we combine it, because Sananga is typically considered for the eyes, but when we open up the entire face, now that Sananga will reach even deeper, and it's more than just treating the eyes, it's treating the entire face that's already been opened up as well, okay? So right now what I want to do is I want to go through more of the purpose of why we would do cranial facial release, because it's an intense thing to consider. Why we would put balloons through the turbinates of our nose.
Show them the instrument.
Okay.
I never got a chance.
What happens, because what we are targeting is we are targeting the sphenoid bone. If you can look at this diagram, what you'll see is that you have 3 turbinate openings on both your left and your right side. So that's 6 openings. You have lower, middle, and upper. And where do they all end up at the end is right there at the target, okay? We're targeting the sphenoid bone. The sphenoid bone is what attaches your face to your cranium, okay? And what is inside the sphenoid bone that is super important for many functions of your body? Can anyone think of a gland that is super important for many different functions that need to happen in your body to function optimally for you to have optimal health?
It's in your head. Guess.
Pituitary.
Which one?
Cranial.
Pituitary.
Okay,
Master one.
so we are stimulating pituitary gland on a major level by doing this therapy. Okay, so there's many reasons why we do this, but let's at least consider all of the functions of what we can stimulate by doing this therapy that are a part of the pituitary gland. Okay, hormones, male and female hormones. Okay, so we have the sex hormones. What else? We have the thyroid gland that is stimulated as a result of pituitary function. Okay. Thyroid affects our metabolic function, temperature regulation. Okay. What else? Pituitary gland. Okay. So this therapy is going to help to mobilize the, does everyone understand? Actually, this is important for you guys to realize. Your skull, the cranium, is made up of 22 separate bones that are the joints that separate these bones are called suture joints.
They look like
okay, so these need to move and be able to be mobilized to function at their best, okay? It's even important during respiration, expiration, okay? When something is calcified and fixated in our skull, okay, this affects blood flow, it affects how healthy of function our brain is, okay, which is underneath our skull, okay? So we are mobilizing the cranial sutures, we are unlocking cranial fixations that are a result of, as we age, calcification, okay? We're preventing neurodegenerative disease, okay? We are not necessarily curing neurodegenerative disease. However, this therapy was pioneered by a doctor who got results treating children that had neurological disease, okay? Was able to improve their condition of Down syndrome, cerebral palsy, autism, these different childhood neurological diseases, okay? So we don't talk about curing. However, potentially it can help someone who already has a neurological disease. But times also what this therapy is going to be very, very useful for is you're going to feel very open, and your breathing capacity is going to be enhanced and increased on another level. Okay, so just like what he mentioned, and I'll have everybody do this before I do the therapy on you as an individual, is I'm going to have you obstruct one nostril and try to take a super deep breath through one side and also the other side. And I want you to be able to feel the difference, if there is any difference. Not everybody may potentially have any difference between left and right, but most of us do. Like for me, my nose deviates to the right.
Same as me. One side works.
So, and oftentimes people ask me, well, doctor, how many times do I have to do this? You know? So I explain to people in the beginning, okay? In the beginning, it's highly recommended that we go through all 6 openings.
They can see it better from the camera.
We go through all 6 openings initially, okay? And then oftentimes, when you do the 6 openings, which is the lower, middle, and upper on both left and right side, there might be 1 or 2 openings that were more difficult than the others, okay? So the 4th session might be going back to what we would call the major areas that needed more attention and open those up a second time, okay? And then, well, is that good for the rest of my life? Well, yeah, I mean, some people are going to be like, wow, that totally changed me for the rest of my life. You know what I mean?
For like a year.
And it does. It does. Mm-hmm. But like everything in life that I've been repetitively explaining to you guys is all the therapies we're showing you, there's always needs to be some maintenance for optimal results, okay? This idea we do it one time and now I'm fixed for the rest of my life, hey, come on.